day, March 9th, I distinctly remember getting a phone call. You got to stop what you're doing. Come back. We have to start designing PPE. We have to start designing infection prevention. We have to start doing this. We realized very quickly that even compared to our usual demographics, in which we care for disproportionately Black, Latinx, and other underserved patient populations in our hospital compared to other hospitals in Boston, we were now seeing that 80 to 85% of our patients were completely patients of color, which is a considerable shift. It was very easy to see who was bearing the brunt of COVID-19.
The numbers started coming in, and we could see what, again, we might have anticipated when they indicated some of the associated comorbidities with people at greater risk. Yeah, that we were talking about my neighborhood. The highest prevalence of asthma is in my neighborhood, heart disease, diabetes. So I knew we were talking about people who looked like me and people who I worship with and shop with and live next door to.
The true tragedy for many of our communities is that people were getting episodic care in the emergency room. We know that the disparities are pretty striking, almost on every disease you and I could name, where Black and brown people are suffering, contracting, suffering, and living shorter lives due to those diseases. And again, it's probably an easier list to create the exceptions than it is to name all the conditions. That's unacceptable. And we know that that's a product of racism. That's a product of neglect, abuse of African Americans in this country.
The medical field has really shown injustice to folks of color, and particularly the Black community. We have the Tuskegee experiments. We have the forced sterilization of Black and Latinx women. The founder of gynecology used the bodies of free Black women using instruments, which were essentially torture, as part of his research without their consent. We just have examples and examples of where there's been a lot of mistrust with the community.
In the healthcare system itself, there is a huge gap between Black people and white people and their financial ability to get access to medications and get access to treatment. It kind of puts a price on your life. The healthcare system has been, for generations, just proving to people that our Black lives don't matter.
I learned several years ago that African Americans are less likely to have the advanced directives in place, what it is that they would want at end-of-life care. My families certainly have highlighted some of the disparities that we have seen. They've talked about not even necessarily being asked what their wishes were, and then when they wanted their wishes honored, not having those honored and respected. When it comes to, again, using some of these life supports, feeling like those kinds of life supports are not available to them. They're maybe available to people who don't look like them. And in many ways have demonstrated that, as I say, while death in America is a great equalizer, dying is not. The kinds of things of which we die, the kinds of care that we get at the end of life is often not comparable. And some of those issues have come up in the context of COVID-19 and how what people would want if they were to get sick.
Many of the communities of color are also feeding the staff for essential frontline work. And as we've gone through reopening, or the cycles of reopening, closing, and then reopening, we'll find that those are the people that are exposed, whether it was in March or whether it's later this year.
We do drive the buses. We are cleaning the kitchens. We are doing all those jobs, cleaning the hospitals. Unfortunately, again, the underlying issue of racism. However, that puts us at a heightened risk. We can't stay home.
There's just a whole spectrum of social issues that have touched the medically underserved and communities of color that I think we have failed to anticipate. I think that what we thought we were doing to prepare is really just the tip of the iceberg. And this pandemic has uncovered so much about what we actually do to ensure appropriate health for all.